Hello and welcome to the Quality Metric Highlight Series. I am your host, Bill Chima, and I'm the SIP Quality Medical Director. This slide deck will focus on the statin and cardiovascular disease quality metric. Let's go ahead and get started. So what are we trying to accomplish? We want to try to prescribe a moderate to high intensity statin to any patient who has an established cardiovascular disease risk factor. We also want to prescribe a statin of any intensity to all of your diabetic patients. Well, why is this appropriate? Cardiovascular disease is the leading cause of death in the United States. It is estimated that 92 million individuals have one or more types of cardiovascular disease. The American College of Cardiology and American Heart Association guidelines state that statins of moderate or high intensity are recommended for adults with established clinical ASCVD. The American Diabetes Association, as well as the American College of Cardiology, also recommends statins for primary prevention of cardiovascular disease in patients with diabetes based off of age and other risk factors as well. Guidelines also state that adherence to statins will aid in ASCVD risk reduction in both population types. This is a slide that shows the intensity of each statin. Remember, for the metrics, there are two. The first metric is for any patient with cardiovascular risk factors, and those patients should be on a high to moderate intensity statin. The second metric is for those who have diabetes, and any intensity statin will qualify. So what can you do to help improve upon this metric? Number one, review your patient action list. If you are not receiving the patient action list, please contact your practice support representative or reach out to the SIP quality team. See who is deficient and reach out to those patients who are on your list. Try to be as proactive as possible. Make sure to review your patient action list at every visit to see if there's an opportunity to close this metric at an in-person or video visit appointment. If possible, bring patients back in the office or do a telemedicine follow-up visit to help counsel patients who are not satisfying this metric, if appropriate. Try to have your staff be engaged and reach out to patients who are on your action list so that way you can counsel those patients when appropriate. Thank you for listening to this presentation. Please feel free to contact Dr. Revelo, Adam Chandler, or myself at the below phone numbers if you have any further questions. Have a great day.